to talk about immobilizing joints. Immobilizing joints and long bones have very similar properties. The main reason that we're going to immobilize a joint is to provide some comfort and stability, which should hopefully reduce some pain and hopefully reduce any further chance of injury. It's important to note that it's not appropriate to render this treatment if the patient's unconscious. Following up our good assessment skills, we want to make sure that we are addressing the life-threatening emergencies that likely could accompany an unconscious patient in a trauma situation. And if we do end up immobilizing that joint, it's probably going to come much later after we've stabilized any life-threatening injuries. So likely your patient's going to be conscious with this. Anytime we're doing any kind of intervention with the patient, we want to maintain our appropriate scene safety, making sure the scene is safe for your partner and yourself, and maintaining good BSI, body substance isolation, using that equipment, your PPE, such as gloves, gowns, eyewear, whatever is appropriate given the situation that you're in. So first thing you need to do is you need to establish your BSI and your scene safe, like I said, and then we need to kind of assess what kind of injury we have. Matt here is going to be our patient. Matt looks like he's self-splinting his arm for comfort. Always remember to talk to your patients, introduce yourself, and don't be afraid to ask where it hurts. It looks like your arm is injured. Do you have any particular spot where it's hurting?
Up here on my shoulder.
Up here on your shoulder, okay. So anytime you remember, assessing a patient is always a hands-on skill. So you don't necessarily want to start at the part that's painful. He's already indicated it's painful here, but we want to make sure that there isn't any other associated injuries besides the shoulder. So one check, is it painful here, down at the elbow? How about down at the forearm, wrist? Can you wiggle your fingers? This is very important for the National Registry test. We always need to check distal CSM, PMS, PSM, however you've learned it or whatever agency is teaching it, standing for circulation, sensory, and motor. We always need to check that before we end up doing any kind of splinting and directly afterwards, which we'll get to. So Matt's been able to wiggle his fingers, so I know he's got movement. Checking his pulse here, he's got a good strong radial pulse. And can you feel me touching your fingers? So it looks like his PSM's intact, and we're going to use that as a barometer to make sure that when we get done rendering the treatment that we haven't made anything worse. All right, so stabilizing shoulder and clavicle injuries, sometimes a humerus injury if we were talking about long bones, but using the sling and swath method is a very efficient and effective way of managing an injury such as this. The way we teach doing sling and swath, we're going to use a triangular bandage. They're going to come in a package like this. And to do the full sling and the swath, typically you would need 2 of them. We'll talk about some other methods afterwards, but that's the packaging. So when you pull the triangular bandage out of the package, it's going to come out looking like this, and you're going to see that there is 2 sides that are significantly longer than one side. You kind of want to use that to help orient yourself to how you're going to place this on your patient. So what I like to say is that I'm going to take the short end, and if it's like an arrow, it's pointing away from the patient's body. Okay? So the first thing we're going to do is take that shortest end and we're going to tie a little knot in it. Now inside that package they do come with safety pins, which you can also use to help shorten the interior length of the triangle bandage, but I think tying a knot works really well, and it kind of gives us a spot to orient. So, have the patient help you. Your patient, like I said, is conscious. You don't need 2 people to do the skill. Sometimes it is helpful, but if you're by yourself, it's actually not difficult to do. Talking to your patient, now I'm going to go ahead and try and sling your shoulder to try and make it feel better and make it so you don't have to hold it the whole time. Okay, so if you don't mind, I'm just going to put this here. Now when we're taking the other 2 ends, it's important to try and orient that bandage appropriately, or the sling won't work well. Can you lift your arm out a little bit? So I'm going to stop right here real quick and I want to show you. So we've got the knotted end on the outside of his elbow, but we want to make sure that both the long grands are crossing in front of the patient. Okay, if we don't do it that way, you're going to find out that the sling's not going to attach the way you want it to. And what I like to do is I like to put in just one overhand knot in the beginning, not overly tight, just to make sure that I'm happy with the way the sling looks. I'm not on this side, so I'm going to tighten that side up a little bit. Sometimes you have to play with it a little bit to get it the way you want it. And then you can tie any knot in the back that you want. It doesn't have to be like a granny knot or anything like that. Once you get to the hospital, the doctor's probably just going to cut this off and he's ready to do his assessment. So can you relax your shoulder and let that sling do the work? Is it nice and relaxed? Okay, perfect. So that part is the sling. Okay, the swath, all that is going to be is you're going to take the other bandage and you're going to try and secure the affected extremity to the patient's body. Okay, so sometimes you got to kind of get a little creative. Step behind the patient. Anytime I'm securing or tying something around a patient's body, I ask them to take a deep breath in and hold it. Take a deep breath in and hold it. Let it out. That way we're not securing the swath around a patient and making it so they don't feel like they can breathe. Again, you can tie any knot in the back just to secure the swath. And hopefully keep that where it's nice and secure around the arm. Holding as much, you want as much of the bandage as possible, securing the arm. Again, as soon as we're done, we need to check his CSM. He still has a good strong radial pulse. Can you wiggle your fingers? Can you feel me touching your fingers?
Yep.
This is how we know that we didn't make the situation worse or that we haven't had an acute change after we got done immobilizing his shoulder. Those are critical fails on the National Registry skill sheet, and those are going to be things you need to remember to do for your National Registry written test. So this is just one way to secure certain joints such as the shoulder and the clavicle, which are commonly injured.